walk us through what the physical therapy session would look like for someone who maybe has that back pain or is recovering from a surgery. What would they be entailed to do?
Sure. So it would focus on a core strengthening in a way that you're not bending, lifting, and twisting. So a lot of people ask, should I start doing crunches or sit-ups? So that's probably the worst thing that you can do for your back, because a lot of times it will put a lot of strain. So you have your hands behind your neck, and the form that I'll see patients trying is doing this, where they're flexing their head, and that doesn't really help anything. So planks are fantastic.
Why are you pointing to me?
Because you brought up the other day in the show that you were going like this.
Oh,
right?
I did. He was here the other day, and I don't like it. I don't have back pain, and it hurts me.
Exactly. So it's just something that I don't understand why a lot of people will recommend crunches, and they just don't work.
Agreed.
So planks are fantastic. A sort of a light Pilates type activity is fantastic. Low impact activities, so going on a recumbent bike or a stationary bike in a way that you're keeping your core straight and just sort of leaning over. Some light arm weights and light leg press. A lot of times, once a patient progresses past the 6-week point, squats can be incorporated, and even weighted squats can be incorporated. But that's after we've healed, and depending on the surgery that you've had.
And the physical therapy is really important, isn't it, Doctor?
Yeah,
absolutely.
Absolutely. And normally, from the non-surgical point of view, when we send the patients out to physical therapy, there's normally 5 stages that the patient will go through. First stage meaning that they will go through the inflammation process, so they will give like icing, heating pads, a little bit of that, what we call modalities, just to kind of help them out. Then they will start getting into the stretching portion, and passive range of motion, so they can start getting some of the range back of their back. Eventually transition into the strengthening portion, which is the most important portion. And then from there on, they will go into what we call the home exercise program. So they learn those exercises and they start doing those in the future at home, which is the most important thing in the long run that will be the long-term medication for the back.